Welcome to this high-yield explainer. If you're gearing up for your upcoming exams or clinical rotations, well, you're in exactly the right place. Today, we're putting a laser focus on mastering emergency protocols, specifically the triage color coding system. Now, this is absolutely foundational knowledge. It's not just going to help you ace your written tests, but it will completely change how you approach those simulated mass casualty scenarios. Okay, let's dive right into our roadmap for today. We'll start with a quick welcome to DIRCET revisions, then move into defining emergency triage, decoding the color priority spectrum, giving you some essential mnemonics and exam tips, and finally, how to ace your OSCE stations. So, starting with Section 1, welcome to DIRCET revisions, enhancing your medical understanding. A huge welcome to DIRCET Premium Revisions. Basically, this platform is designed to be your ultimate study resource. Our goal here is actually pretty simple. We want to equip you with powerful revision tools that elevate your academic performance and literally just ensure your success. Look, you're already putting in the hard work, right? Our aim is just to make that work highly efficient and get you totally exam ready. Moving on to Section 2, defining emergency triage, the systemic solution. Picture this for a second. You walk into an absolutely overwhelmed emergency room, or maybe there's a sudden mass casualty incident where the number of patients vastly outnumbers the available medical personnel and supplies. It's total chaos, right? Well, triage is your systemic solution to that chaos. It's the highly specific process of sorting patients according to the severity of their condition and the urgency of their treatment. The crucial point here is that when resources are completely overwhelmed, you can't just treat the first person you see. You have to make incredibly fast, sometimes really difficult decisions to ensure you're doing the most good for the most people. Which brings us to Section 3, the color priority spectrum, decoding the matrix. Decoding all that chaos requires a really strict matrix, and it's based on 4 primary colors: red, yellow, green, and black. Now, as a quick side note, you might occasionally see blue used in some systems instead of black, but the concept is the same. Red is priority 1. That means immediate, life-threatening injuries like severe bleeding or a tension pneumothorax. On the other end, down at priority 3, you have green, representing minor injuries. You'll often hear these folks called the walking wounded. Seeing the protocols laid out like this really brilliantly illustrates how clinical presentations map directly to a prioritized action plan. Let's break this down a bit further by contrasting our top 2 priorities. Priority 1, the red tag, means immediate treatment is absolutely required. We're talking patients with airway obstructions, shock, or major burns. They literally can't wait. On the other hand, priority 2, the yellow tag, means treatment can be delayed for a short time. Now, don't get me wrong, this doesn't mean the patient isn't seriously hurt. A yellow-tagged patient might have a stable abdominal injury, moderate burns, or even a long bone fracture. Both are super serious, but the key distinction you need for your exams is time. The yellow-tagged patient is stable enough to wait a little bit, whereas the red-tagged patient will likely die without immediate intervention. Now, let's contrast the other end of the spectrum. Priority 3, the green tag, is for minor cuts, sprains, and abrasions. Basically, if the patient can walk themselves to a designated area, they get a green tag, and you treat them last. But then, we have to face the incredibly difficult reality of the expectant category, which is the black tag. In a true mass casualty incident where resources are severely limited, a black tag indicates that a patient is already deceased, meaning no pulse or breathing even after you reposition their airway, or they have injuries that are just fundamentally incompatible with survival, like a catastrophic head injury. In these overwhelming situations, no active resuscitation is attempted. Instead, if resources allow, comfort care is provided. It's a really harsh reality of disaster medicine, for sure, but it's an absolutely vital protocol for you to understand. All right, Section 4, mnemonics and exam tips, memorization tools. Now, what's really interesting about this, and what's going to save you on test day, are these mental shortcuts. To lock this in for instant recall, use these 4 quick phrases. Red equals right now. Yellow equals wait. Green equals go, as in the walking wounded can go to a secondary location. And black equals beyond help, or deceased. Seriously, if you get stuck on a tricky multiple choice question, just take a breath and recite right now, wait, go, beyond help. Let's see how this builds into your actual clinical application. When you're asked about the treatment sequence in a triage scenario, you absolutely must follow this exact order. Step 1, treat red immediately. Step 2, treat yellow after your red-tagged patients are stabilized. Step 3, treat green last. And step 4, address black-tagged patients with comfort care only, recognizing there's no active resuscitation during a true resource overwhelm. You really want to burn this exact sequence into your brain: red, yellow, green, black. Finally, Section 5. Ace your OSCE stations, continuing your journey. Look, knowing the theory is only step 1. You actually need to practice. And that is exactly what Dear Cat's comprehensive resources are built for. You can access all courses for concise notes and quizzes. But more importantly, for this specific topic, you've got to jump into the OSCE stations section. The practical guides and mock scenarios there walk you through clinical skills step by step so you're totally ready for the real deal. You can also join interactive online classes for live exam-focused discussions, or check out our tutorial videos on TikTok and YouTube for some quick, on-the-go refreshers. So, what does this all mean for you? Well, we've broken down the matrix, we've gone through the clinical examples, and we've armed you with the exact mnemonics you need. I'm going to leave you with this final thought. Are you ready to face a mass casualty scenario in your next OSCE? Take these rules, visualize the colors, and walk into that mock scenario knowing exactly who gets treated first, who waits, and exactly why. Thanks so much for joining me for this explainer, and I will see you in the next study session.